the Caregiver Connection podcast by Best Care, where we dive into new topics each week, drawing inspiration from our insightful and educational blog posts. We're committed to providing valuable information that impacts both home care clients and caregivers. Without further ado, let's jump into this week's episode. Support for spiraling depression. Caring for someone who is experiencing spiraling depression can feel overwhelming. This condition affects not just the individual dealing with their mental health issues, but also the caregivers and loved ones who support them. If you've ever wondered how to live with someone with depression or how to help someone who is spiraling, it's essential to be equipped with the knowledge and tools needed to provide effective care and support. Today aims to offer insights into recognizing the signs of depression, how to support a loved one effectively, and tips for seeking professional care. What is spiraling depression? Spiraling depression is a term used to describe the feeling of being pulled deeper and deeper into a state of depression. It's like being caught in a downward spiral of negative thoughts, emotions, and behaviors that seem to feed off each other and intensify over time. This can lead to a sense of hopelessness and helplessness, making it difficult to break free from the cycle. How to care for someone with depression. Caring for someone with spiraling depression involves a multifaceted approach rooted in compassion and attentiveness. Mayo Clinic offers these insights. People with depression may not know or admit that they're depressed. They may not be aware of the symptoms of depression, so they may think their feelings are normal. People often feel ashamed about their depression, mistakenly believing they should be able to overcome it with willpower alone. But depression seldom gets better without treatment and may get worse. With the right treatment, it can get better. Here are some essential strategies. Recognize the signs. Understanding the symptoms of a depressive spiral is crucial. These can include a persistently low mood, loss of interest in activities, changes in sleep and appetite, feelings of worthlessness, and suicidal thoughts. By recognizing these signs early, you can take appropriate actions to support your loved one. Encourage professional help. Encourage the individual to seek professional guidance. Depression seldom improves without treatment. Offer to help by setting up appointments, preparing questions for healthcare providers, and attending therapy sessions if the person is comfortable. Be supportive and non-judgmental. It's essential to create a supportive environment where your loved one feels safe to express their feelings without fear of judgment. Listen attentively, offer empathy, and reassure them that depression is a health condition that can be managed with appropriate care. Implement daily routines. Help establish a daily routine that promotes stability and reduces stress. This can include regular meals, physical activity, social interactions, and consistent sleep schedules. Routines provide a sense of control and predictability for someone in the throes of depression. Watch for worsening symptoms. Be vigilant for signs of worsening depression or suicidal behavior. Immediate intervention may be necessary, such as contacting healthcare providers or emergency services to ensure the person's safety. If your loved one is in crisis, please call the 988 Suicide and Crisis Lifeline or contact the crisis text line by texting TALK to 741-741. How to find care if you're living with chronic depression. If you're personally dealing with depression, finding the right support system is vital. Here are some steps to consider. Seek professional help. Consult with a healthcare provider to get a proper diagnosis and create a treatment plan tailored to your needs. Medications, therapy, and lifestyle changes can significantly impact managing depression. Consider home care services. For individuals who need additional support, home care services can be a lifeline. Home care professionals provide consistent, personalized assistance that goes beyond basic care, including medication management, companionship, and daily task support. Utilize support networks. Connect with organizations and support groups dedicated to mental health. Groups like the National Alliance on Mental Health Illness, also known as NAMI, offer resources, counseling, and peer support that can be very beneficial. Practice self-care. Incorporate self-care routines into your daily life. This can include healthy eating, exercise, meditation, and engaging in activities that you enjoy. Self-care is not indulgent. It's essential for managing your mental health. Communicate with loved ones. Openly communicate your needs with family and friends. Let them know how they can support you, whether it's through regular check-ins, accompanying you to appointments, or simply being there to listen. Remember, if you are in crisis, please call the 988 Suicide and Crisis Lifeline or contact the crisis text line by texting TALK to 741-741. Supporting someone through spiraling depression or managing your own chronic depression requires a compassionate and proactive approach. It's about understanding the nuances of the condition, fostering open communication, and utilizing all available resources to ensure well-being. Stay connected to Best Care. At Best Care, we're dedicated to providing comprehensive support for individuals and families who need home care support. Our team is here to help with all of your questions related to family caregiving. Contact us today to learn more about how we can assist you. If you find this podcast helpful, share this with a friend, leave a review, and don't forget to subscribe. Contact us today for expert guidance and support. Visit bestcaremn.com. Thanks for listening to the Caregiver Connection.